And welcome back to Community Viewpoint. I'm John Pawlak, your host again. And I'd like to take this time to talk about a wonderful group of people. One of them is sitting next to me. It's Nathan Adelson Hospice. We are having them on once again because they have moved, and we want you to know where their offices are and how to find them. So we have with us this afternoon Tyann James from that office. She's the outreach representative, let's say?
Yes. Community outreach.
And community outreach. And you're a local resident, and you've done a lot of other things, but we're talking about Nathan Adelson, positive things.
Yes.
So tell us a little bit about where you've been and where you are and where you're going to be.
Okay, so we did move. That was very exciting. I was lucky enough to be on vacation when it actually happened.
Oh, good for you.
We moved. We used to be on Highway 160, so we were at 1401 Highway 160. And now we moved.
That was Dr. Stacy's old office?
That's correct, and now it's a Healthcare Partners office again.
Okay.
So we have moved up to Southwest Medical's old office.
Which was
Dr. Levasseurs' office. Which is at 2270 Commercial Drive, and we're in Suite A and B. So it's just up the street, not very far.
Up the road a piece, as they say out here. So we have that down on tape. So Tyann, you and Nathan Adelson do so many wonderful things for the community, for the folks here. Tell us about some of your programs that you have, if you would, please.
Sure. Everybody knows, well, I hope that everybody knows about hospice and what hospice can do. But I really want to take just a second to talk about our palliative program, because that's newer for us. It has been in progress for a few years, but it's here and we're working it, and it's here in Pahrump, so I'm excited about it. Palliative care is something that they used to call hospice, but there is a difference. So the hospice care is end-of-life care, as we know, 6 months or less, according to a physician's diagnosis. And palliative care is more of comfort measures. So there is no reimbursement in Medicare or any of the insurances for palliative care. So it is strictly philanthropic. So Elaine Wynn and her daughters donated $1 million to our palliative care program, which is why it's called the Elaine Wynn Palliative Care Program. And what that allows us to do, besides educate people, it allows us to take our program a step further, and we can actually send an RN into the home to evaluate these people that might be looking at palliative care and talk to them about their goals of care, maybe talk to them about their meds. We can be kind of that bridge between the physician and the patient. Maybe the patient can't get in to see the physician quickly and they need that.
Right.
Maybe they can't get in at all and the physician's worried about this patient. Maybe they just are having trouble managing symptoms. Sometimes pain is huge, and it's hard to get in control. Maybe you're seeing two different doctors and you're being prescribed all these meds and they're conflicting with each other, and maybe one physician doesn't know that doctor's prescribing this, and
that could be quite dangerous.
Absolutely.
Yeah.
So it's a great program where basically we have to have a referral from a physician, and then we can send our nurse to your home to evaluate you, go over your care goals, what you want to get from this program, and then what we do is we give you resources. If you just need maybe some extra care in the home, we can give you some numbers and places to call, contact programs that are available that might be able to help. And then we also can contact your physician and give them recommendations, and if they choose to take them, great. But it's just an extra set of eyes in the home, extra set, and a little measure of comfort knowing that somebody's going to be calling or coming out to see you, set eyes on you once a week. So that, if you're having an issue, maybe something has just cropped up, or maybe you're starting to get an infection of some sort, because people that are prone to those, they know when they're coming on, and you can't get into the physician quickly enough. So you can tell this nurse that, and we can call the doctor and get what you need prescribed so that you don't, it doesn't turn into a full-blown issue.
Right, so our doctors in the area here know about your services then.
Yes, they do. And we've also opened a palliative clinic with, it's not in conjunction with Healthcare Partners, but it's at their specialist's office at the physical address is 1151 South Highway 160, but it's, as we all know, I think that's on Postal Road. So that's where all the specialists that come in from Vegas go. And our nurse practitioner is there every first and third Tuesday. So if you're interested and you can make an appointment, you can do that as well and spend a good half hour to an hour with our nurse practitioner going over your meds, talking about what you want, for goals of care, And the good thing also about palliative care, because with hospice you can't be seeking curative treatment at all. But with palliative care, you can be receiving treatment. You can have home health agencies in the home. You can be receiving services from anybody because it's not a billable service. The palliative care, it's totally philanthropic. So we're not stepping on Medicare's toes by double billing.
You have the money from Mrs. Wynn.
That is correct, very generously. So
yes.
yeah. So we're very, very excited about this program because we think that we're going to be able to reach a lot of people that aren't hospice ready. Maybe they're still, that word scares a lot of people.
Yes.
Yeah. So
it started to scare me after I realized what it was.
I know, and it can, but it's it's a better alternative to not having it, and this can kind of help ease you, into what the philosophy is.
Yes, I had a friend that was in hospice care, and he had your doctor that was one of my favorite doctors. He would go over there, and he made his life towards the end really worthwhile because he would connect with this individual, and this individual lasted a lot longer, thankfully.
Yep.
And he had a real good friendship with this doctor, and so I see where it helps too.
Yeah.
And I remember I was at the house one time, and he needed a specific prescription, and someone was sent over with the prescription. I says, "This is fantastic."
Yes.
Yes.
Yeah.
So don't be bashful. Nathan Adelson Hospice, and they do a lot of good. You do a lot of good.
Well, our nurses and staff, the people that go into the homes, they really do.
Yes.
Yes.
These are very special people.
They are.
So let's talk about other things that
Sure.
You're the butterfly
I've got
lady.
a lot. I am the butterfly lady.
Yes.
I've got a lot of things I could talk about. Nathan Adelson, we do have a few fundraisers every year that we try to reach out so that we can keep funding the people that don't have insurance. That's basically what our fundraisers cover. That and other programs that we have, our complementary therapies programs, and we have a pet therapy program. We have a pet peace of mind program for patients who are on hospice that have pets and they're worried about what's going to happen to them. We can help find a solution for them so that they don't have to worry about that. So we also have our golf tournament coming up September 12th. That will be at the Mountain Falls Golf Club. And it's a shotgun start. I believe at 8 a.m. is registration. It's $75 per golfer, $300 for a foursome. And that gets you the round of golf with your golf cart and lunch afterwards. And if you're interested in hearing more about that, because there are still probably some sponsorship opportunities available, you can call Stephanie Forbes at 702-938-3910.
Fantastic. That's the golf.
Correct.
And the butterflies are when?
That's in
April?
the spring. Yeah, usually April or May.
Okay.
Okay, and last year, when we did it this year, actually, we had it for the first time at the Calvada Eye, and that was
That's right.
beautiful.
Yes, yes.
That was beautiful. I think we're going to try to continue to have it there. That was a beautiful location, so that worked out well.
That's being massaged into a wonderful place to have events.
Yeah,
Yes.
I agree.
And then we were talking about something that's coming up in December. That's
Yes.
something to look forward to in the colder months, and that's the tree.
Yeah, our Festival of Trees.
Okay.
So that's another fundraiser that we do, and it's our largest fundraising event generally. It's kind of our dress-up event, so we're still working out details, so I don't want to give out too much, but we are going to be partnering with Rotary of Pahrump this time, so they're going to be helping us, which is great. And it's going to be at Mountain Falls, I do know that. I believe the date is December 5th. If that's a Friday, that's the date. So it is moving to a Friday. And I think that we're kind of changing it up because this year will be our 10th anniversary.
Oh, okay.
So what I think we're going to do, instead of a sit-down dinner, we're talking about doing a heavy hors d'oeuvres and a cocktail hour
Okay.
kind of thing. So stay tuned for more details on that because I don't have them all now. But like I said, we're always asking for things from people because of what we do. We want to help as many people as possible. But I'm starting to branch out, and I'm working on a couple of projects with some other companies here in town, healthcare partners, Integrity Home Health, pardon me,
yes.
and Nevada Eye and Ear. And we're going to be, we have a movie night that we're going to present for kids, school-aged. We're doing probably 5 years to middle school aged. We're having a movie night on September 6th at the Coalition Building at their
Activities building?
Yes, their activities
we
building.
We keep changing the name, so I don't know what it is. We won't keep anybody happy because I don't know the name myself.
I think that's what's up there now.
But the large activity building.
Yes.
Yes.
And so we're going to be showing Despicable Me 2, and it's a $5 donation, and that gets you in the door to watch the movie, and it gets you a drink and either popcorn or a candy item. And the proceeds from this are going to benefit the McKinney-Vento program for homeless children here in Pahrump. So
and we have those, unfortunately.
Unfortunately,
yes.
we have quite a few.
Yes.
So that is one of the events that we're going to try and sponsor to give back a little bit. And then also in September on the 16th, we are looking at, we're going to have a hoedown. We're getting together with the same people, healthcare partners, Integrity Home Health and Nevada Eye and Ear. And we're going to be sponsoring, like I said, a hoedown. And this is going to benefit the Senior Center's Meals on Wheels program, which we know is also very important and very in a lot of need. So this should be fun. I mean, it's not going to be a dinner. It's, again, going to be heavy hors d'oeuvres. And it's going to have a cash bar. We're going to have some raffles, picture taking. It's going to be fun. We're going to have the dance floor open with a DJ. We're going to have somebody there teaching line dancing, and it should be fun. It's only $10 to get in, and again, those proceeds are going to go to the Meals on Wheels program.
Oh, that's great.
Yeah.
And the meals that they have there at the Senior Center are very good too.
They really are.
Yes, they are. Funny quick story. I do have a valid handicap sticker, right? So I go to the Senior Center and try to get a good spot. Everybody's got a handicap
They all do.
There's no way I can get a good spot.
That's right.
But it's relatively inexpensive. And I forget what the prices are. They have to go up just a little bit, but I think you get there around 11 o'clock, and then you hear lovely speakers like we had Sam Marlino earlier, and then you would be over there telling them about what Nathan Adelson Hospice says, and I think we're almost out already.
Okay.
But I want to thank you for coming,
you.
and we will see you next week and the week after, whether you like it or not. But thank you very much. Thank you, Tyann.
Thank you.
Thank you.